So in this lesson, you will have been looking at definition of a drug to begin with. Now, just to remind you, a drug is a chemical substance that has a physiological effect on the body. Now, you might be expected to remember some examples of drugs and what they were developed from. So one example would be aspirin. Now, aspirin comes from a natural product that's contained within the bark that you find on willow trees. There is the drug digitalis, which is given to heart patients for irregular heartbeats, and that comes from the foxglove plant. And then one way you might be expected to go a little bit more into the historical context, and that is penicillin, which comes from Penicillium mold, and was first antibiotic developed by a bloke called Alexander Fleming, just to jog your memories. Then there are the ways in which you classify drugs. Now, obviously, drugs can be classified in terms of their legality, but also they can be classified in terms of their use. So one such type of drug would be painkillers to relieve pain and reduce symptoms like fever that you might have in cold and flu. You also get antibiotics. Now, they stop and prevent the growth of bacteria only. So if you have a virus or fungal infection, you don't take antibiotics. You only take them if you've got an antibiotic, if you've got a bacterial infection. And in terms of antibiotics and bacteria, you can end up with bacteria that become resistant to antibiotics, which means that the antibiotics stop working on them. And that's obviously a bad thing. And the reason why this happens is bacteria, they reproduce rapidly. Excuse me. And as part of that reproduction, they can undergo genetic mutation in the genes and DNA that they carry. And sometimes, by chance, that mutation can bring about resistance to antibiotics. So if the bacteria mutates and becomes resistant, bacteria then continues to reproduce quickly, and that resistance can spread through the whole population. So an example of a highly resistant strain of infection is MRSA, which you often find associated and being found in infecting people actually in hospitals.